Hello everyone, welcome back to Healthy Care. The liver, a resilient and quiet organ that performs hundreds of tasks every day, from detoxifying the body and metabolizing nutrients to regulating our energy. Yet, it rarely sends clear signals when things go wrong, making it easy for us to overlook potential issues. This is why liver diseases often progress silently within the body for many years. In the United States alone, over 4.5 million people are affected by liver issues. But the majority only discover it when the disease has reached advanced stages, causing significant and sometimes irreversible damage to their health. Did you know that by the time clear symptoms appear, the liver may have already lost up to 75% of its functional capacity? This is a reminder of just how essential early detection and liver care are. In today's video, Healthy Care will help you understand the early warning signs of liver disease and share practical liver care methods from leading experts. Whether it's small lifestyle changes or important dietary adjustments, you have the power to protect your liver early and support a long, healthy life. Don't wait until it's too late. Start taking action today to protect your liver and your overall health. 1. Sensitivity to temperature. Sensitivity to temperature is often an overlooked symptom. Yet it's a significant sign in individuals with chronic liver diseases such as cirrhosis or hepatitis. When the liver's function declines, it struggles to regulate metabolic processes and blood circulation efficiently, impairing the body's ability to maintain stable temperature. As a result, patients may feel unusually cold even in warm environments, or they may experience excessive sweating when the weather is only mildly warm. This makes daily life uncomfortable, as they frequently need to wear multiple layers or constantly use fans or air conditioning to stay comfortable. According to the American Institute of Tropical Medicine and Liver Studies, a survey of 1,500 cirrhosis patients found that up to 38% reported difficulty controlling body temperature, with 15% saying they had to modify their lifestyle to stay warm or cool. Emily Sanders, a 59-year-old teacher from Houston, Texas, is a typical case. She constantly wears extra layers even when the temperature is moderate, and keeps a warm blanket around the house year-round. Initially, Emily thought her sensitivity was due to aging, but as her symptoms worsened, she sought medical advice. Test results revealed she had cirrhosis, a condition that had developed over several years without her awareness. Emily's temperature sensitivity was her liver's way of signaling its distress, emphasizing the importance of paying attention to subtle changes in the body. 2. Foamy urine. Foamy urine is a symptom that many might dismiss, yet it can be an early warning of liver dysfunction. When the liver is weakened, its ability to process and metabolize proteins becomes compromised, leading to excess protein that can leak into the bloodstream and be filtered out by the kidneys. As the kidneys work overtime to remove these proteins, urine appears foamy, a seemingly minor detail that actually signifies important information about liver health. A study from Johns Hopkins University found that, among 1,200 patients with non-alcoholic fatty liver disease (NAFLD), 12% reported persistently foamy urine. Surprisingly, 60% of these individuals were unaware that this could be a liver symptom, with more than half only recognizing the issue once the disease had progressed. John Brown, a 50-year-old truck driver from Los Angeles, California, initially ignored his foamy urine, attributing it to dehydration or the effects of certain supplements. But as the condition persisted, John decided to check in with his doctor, who discovered he had fatty liver, a silent condition that had been slowly worsening. Thanks to the timely detection prompted by his foamy urine, John realized the importance of his liver health and made lifestyle changes to prevent further progression of the disease. 3. Tightness in the neck area. A sense of tightness or mild pain around the neck and shoulder area is often mistaken for musculoskeletal issues, but it can also be a sign of liver problems. The liver plays a vital role in maintaining blood circulation through the portal vein system. When the liver becomes damaged, this function weakens, causing increased pressure on large blood vessels surrounding the neck and shoulders, resulting in a sensation of stiffness, sometimes spreading to the upper back. A study published in the International Journal of Hepatology found that among 850 cirrhosis patients involved in the research, 22% reported experiencing tightness in the neck and shoulders, with most initially attributing it to prolonged sitting or stress. Anna Williams, a 48-year-old office worker in New York, exemplifies this symptom. She frequently experienced neck and shoulder stiffness, particularly at the end of her workday. Initially, Anna assumed it was due to prolonged desk work, but even after adjusting her posture and incorporating light exercise, the discomfort persisted. After a full health check, doctors diagnosed her with chronic hepatitis B, which had impaired her liver's ability to regulate blood flow effectively. The tightness in her neck and shoulders was her liver's way of signaling its distress, though it had been misinterpreted for a long time. 4. Excessive hair loss and thinning body hair. Hair loss and body hair thinning may seem related to stress or aging, yet these could also signal underlying liver issues. The liver is essential for regulating hormones, chemicals that play a major role in the health of hair and body hair. When the liver cannot balance hormones efficiently, levels of estrogen and testosterone may be affected, leading to significant hair loss and thinning body hair. A study from the Texas Institute for Health Research found that 18% of cirrhosis patients reported severe hair loss and body hair thinning, many of whom initially misinterpreted the symptom as stress-related or due to poor nutrition. Mary Thompson, a 53-year-old sales associate in Dallas, Texas, noticed an alarming amount of hair loss during showers, and the hair on her arms and legs began to thin. At first, she tried anti-hair loss shampoos and increased her nutrient intake, but the condition did not improve. Finally, Mary went for a full health screening and discovered her liver was at the early stages of fatty liver disease. Doctors explained that her liver's weakened state had led to hormone imbalances, causing her hair loss and body hair thinning. By changing her diet and adhering to a treatment plan to support her liver, Mary helped prevent her hair loss from worsening, underscoring the liver's importance in overall health. 5. Chronic fatigue and lack of energy. Chronic fatigue and lack of energy are common symptoms, but few realize they can be a warning sign from a damaged liver. The liver is the body's main organ for energy metabolism, helping to break down glucose and fatty acids to provide essential energy. When the liver is damaged, this process is disrupted, reducing the liver's ability to metabolize and store energy, leading to a persistent feeling of exhaustion, even when the patient is well rested. Moreover, when the liver's ability to filter toxins is weakened, toxins accumulate in the blood, putting pressure on the central nervous system and increasing feelings of fatigue and physical weakness. It is estimated that up to 75% of patients with non-alcoholic fatty liver disease (NAFLD) report symptoms of chronic fatigue and lack of energy. Alice Nguyen, 46, an accountant in Los Angeles, is a high-performing worker who suddenly found herself exhausted every afternoon, despite trying to get enough sleep and reduce her workload. She often lost concentration and felt as if her body was out of battery. After a medical checkup, Alice discovered that her fatty liver disease had been developing over the years due to a sedentary lifestyle and a diet high in sugar and fat. Fatigue was the first sign her body sent to warn her about the condition of her liver. 6. Joint and muscle pain. Joint and muscle pain is often mistaken for typical joint problems, but in cases of autoimmune hepatitis, it is an important sign warning of liver damage. Autoimmune hepatitis is a condition in which the immune system mistakenly attacks liver cells, causing inflammation and damage to liver tissue. However, when the liver becomes inflamed due to immune system attacks, this inflammation can spread to the joints and muscles, causing prolonged pain and soreness. Patients often experience severe joint pain, especially in large joints like the knees, wrists, elbows, and sometimes fingers, accompanied by swelling and stiffness, particularly in the morning. Statistics from the National Institute of Health show that about 20 to 30% of autoimmune hepatitis patients experience joint and muscle pain, with varying degrees of severity, from mild to intense. Linda Martinez, 52, a primary school teacher in Seattle, Washington, frequently suffers from joint pain in her wrists and fingers, making it extremely difficult to write on the board and perform daily teaching activities. Initially, Linda thought she just had arthritis due to age and work pressure, but the pain did not subside even after taking pain relief medication. After a medical examination, the doctor discovered that Linda had autoimmune hepatitis, causing her immune system to attack both her liver and joints. Her autoimmune hepatitis required her to adjust her diet, rest more frequently, and take medication to manage the pain. 7. Loss of appetite. Loss of appetite is a symptom few people associate with liver disease, but it is an important sign, particularly in patients with cirrhosis and non-alcoholic fatty liver disease. The liver plays an essential role in digestion, helping to produce bile, a substance necessary for digesting and absorbing fats. When the liver is damaged, its ability to produce bile decreases, causing patients to feel bloated, have indigestion, and lose their appetite. Prolonged loss of appetite can lead to nutritional deficiencies, resulting in unexplained weight loss and malnutrition. If left untreated, a lack of appetite can weaken the immune system, making the body more susceptible to infections. A report from the American Liver Association shows that nearly 50% of patients with cirrhosis and fatty liver disease experience loss of appetite, with 30% facing sudden weight loss issues. This factor increases the risk of malnutrition and adversely affects disease progression. William Adams, 62, the owner of a bookstore in Portland, Oregon, noticed over a few months that he began to lose his appetite, even for his favorite foods. Initially, William thought this was due to aging and work pressure, but when his weight dropped by 8 kilograms 17 pounds over 3 months without any clear reason, he decided to see a doctor. After testing, doctors found that he had cirrhosis due to long-term fatty liver disease. His loss of appetite was not only a sign of serious liver damage, but also resulted in a loss of essential nutrients. Since then, he has had to adjust his diet and take supportive medications to restore liver function and maintain a stable weight. 8. Abdominal swelling, ascites. Abdominal swelling, also known as ascites, occurs when fluid accumulates in the abdominal cavity due to the liver's inability to effectively filter blood. This condition typically appears in the later stages of liver disease, especially cirrhosis, when the liver is severely damaged and pressure increases in the portal vein system. The fluid buildup not only causes a feeling of tightness and discomfort, but also leads to a distended belly, resembling pregnancy, which can impact breathing and daily activities. Ascites is a serious warning sign that the liver has suffered significant damage and requires urgent treatment to manage. According to the American Liver Association, approximately 50% of cirrhosis patients develop ascites within 10 years of the disease's onset. This statistic highlights the severe progression of the disease and the level of damage to the liver. David Rogers, a 60-year-old carpenter from Phoenix, Arizona, noticed that his belly began to swell despite no weight gain. Initially, David thought it was just abdominal fat accumulation, but as the discomfort grew worse, he decided to seek medical attention. The doctor diagnosed him with ascites due to end-stage cirrhosis, the result of years of hard labor and frequent alcohol consumption. His ascites affected his breathing and daily activities, requiring immediate treatment to reduce fluid accumulation and help improve liver function. Easy bruising and bleeding. The liver is essential for producing clotting factors necessary to control bleeding in the body. When the liver is damaged, the production of these factors decreases, making individuals prone to easy bleeding or bruising, even with minor impacts. Unusual bruises can appear on the skin, and individuals may experience bleeding gums or nosebleeds without a clear cause. This is a sign that the liver is in a weakened state and unable to produce crucial clotting factors, posing a risk for bleeding and minor bumps or injuries. According to the National Institutes of Health, about 25 to 35% of patients with cirrhosis or chronic hepatitis experience easy bruising and bleeding due to impaired blood clotting functions of the liver. Sarah White, a 55-year-old homemaker from Chicago, Illinois, frequently noticed unexplained bruises on her arms and legs. Additionally, she often experienced gum bleeding while brushing her teeth. At first, Sarah thought this was simply a sign of aging or a vitamin deficiency, but as the condition persisted, she decided to see a doctor and was diagnosed with chronic hepatitis. Her liver function had deteriorated significantly, reducing its ability to produce clotting factors, making her body prone to bruising and bleeding. 10. Skin darkening. Skin darkening in areas such as the armpits, neck, and face is a common symptom in people with liver problems, especially when the liver is severely damaged or loses its ability to regulate hormones and metabolism. When the liver can no longer effectively control hormone levels and detoxify, the buildup of these substances in the blood can cause the skin to darken, creating areas of hyperpigmentation. This darkening, or hyperpigmentation, results from disrupted melanin production due to the liver's reduced efficiency in managing hormone production. This symptom is commonly seen in skin folds like the armpits and neck, as well as on the face, causing patients to feel self-conscious and often misinterpret it as a dermatological issue. According to a study published in the International Journal of Hepatology involving 1,200 chronic liver disease patients, up to 30% experienced skin darkening. Among these, 70% reported that the dark patches primarily appeared on the neck, armpits, and face, highlighting these areas as the most susceptible when the liver's functionality declines. Jennifer Collins, a 44-year-old marketing professional in San Francisco, noticed her neck gradually darkening over a year, even though she rarely exposed herself to sunlight. Initially, she thought this was due to aging or the effects of skincare products. However, as the condition became more noticeable and spread to her armpits, Jennifer decided to consult a doctor. She was diagnosed with early-stage cirrhosis caused by chronic hepatitis B, and the skin darkening was actually a sign from her liver, caused by hormone imbalance and toxin buildup. 11. Rash or pimples. Liver dysfunction can make the skin more sensitive and prone to irritation, leading to symptoms such as rashes, pimples, or an itchy sensation. The liver plays a key role in removing toxins from the blood, but when it can no longer perform this function effectively, toxins accumulate in the body, causing allergic and irritant reactions on the skin. These symptoms often appear on the face, arms, or other sensitive skin areas, and may be accompanied by pimples or prolonged itchiness. Such signs indicate that the body is reacting to toxin buildup because the liver cannot process and eliminate these toxins efficiently. A condition common in patients with cirrhosis or chronic hepatitis. A study from Harvard Medical School shows that about 20 to 30% of patients with cirrhosis or chronic hepatitis experience rashes and pimples, primarily on sensitive skin areas. George Miller, a 51-year-old transportation worker in Boston, Massachusetts, frequently experienced rashes and itching on his arms and face. Initially, George thought it might be due to a skincare product allergy or changing weather conditions. However, the rash persisted and did not improve despite trying various anti-itch creams. After consulting a doctor and undergoing necessary tests, it was discovered that George had cirrhosis due to prolonged alcohol use. His liver function had deteriorated, causing toxins to accumulate in the blood, which irritated the skin and triggered the rash. Managing his liver health helped George alleviate the rash and improve his skin condition. Your liver is a quiet guardian, working tirelessly each day to keep your body balanced and healthy. Yet when it starts to struggle, subtle signs may emerge that are often easy to overlook or dismiss. Throughout this video, we've highlighted key indicators that could suggest your liver needs more attention. along with simple, actionable steps you can take to protect and support this vital organ. By being aware of these early signs and making small but meaningful changes, you can truly make a difference in your long-term health. A healthy liver is foundational to overall wellness, impacting everything from energy levels to immunity. Recognizing these early signals allows us to be proactive, rather than reactive, in protecting our health. If you found this video valuable, please consider hitting subscribe to stay connected with us at Healthy Care. Together, let's build a community focused on informed and preventative health, empowering ourselves and those we love to lead healthier lives. Thank you for watching, and we look forward to seeing you in our next video with more tips for a healthier, happier life. Welcome back to our channel. Are you ready to discover how something as simple as an onion can transform your health? In today's video, we're diving deep into the incredible benefits of consuming onions in specific ways. Not only can they make you feel up to 10 years younger, but they also play a crucial role in enhancing your overall well-being and helping to treat various diseases. Imagine harnessing the power of these humble vegetables to boost your immune system, improve digestion, and even support heart health. But remember, it's not just about eating any onion. Selecting the right type and preparing them correctly is key to unlocking their full potential. So, whether you're a seasoned onion enthusiast or someone curious about incorporating more of these nutritional powerhouses into your diet, you're in the right place. If you've experienced the remarkable health benefits of onions, please show us your support by liking this video. And if you're new to our community, make sure to subscribe and turn on the notification bell so you never miss an update on our latest health tips and insights. Let's get started on this flavorful journey to better health. 1. Cancer prevention. Raw onions contain bioactive compounds that may help prevent cancer. These include flavonoids like quercetin and its derivatives and sulfur compounds such as cysteine sulfoxides and onion A. A 2019 study in phytotherapy research highlighted that these flavonoids inhibit tumor growth and proliferation. Quercetin, in particular, induces apoptosis, programmed cell death, in cancer cells and inhibits angiogenesis, formation of new blood vessels that tumors need. Onion A has shown promise in suppressing ovarian cancer. A 2016 study in Scientific Reports found that onion A interferes with the tumor microenvironment, hindering cancer cells' ability to proliferate and invade healthy tissues. Cysteine sulfoxides in onions form organosulfur compounds when chopped or chewed, which have chemopreventive properties. These compounds help detoxify carcinogens and enhance antioxidant defenses. Overall, the synergistic effects of these compounds make raw onions a valuable addition to a cancer prevention diet. Including raw onions can provide a natural approach to cancer prevention, utilizing their potent antioxidant, anti-inflammatory, and chemopreventive properties. 2. Improves vision health. Including raw onions in your diet can boost vision health due to beneficial compounds like quercetin and cysteine sulfoxides. Quercetin, a powerful antioxidant in onions, protects against ocular inflammation and reduces the risk of cataracts. A 2021 study in antioxidants found that dietary quercetin helps manage oxidative stress and mitigates age-related eye diseases. Cysteine sulfoxides, which give onions their pungent smell, are crucial for eye health as they are precursors to glutathione. Glutathione is a vital antioxidant in the eye that protects the lens from oxidative damage and prevents cataracts. Incorporating raw onions into your diet supports and preserves vision health, protecting against oxidative stress and age-related vision issues. 3. Improves bone health. Research shows that compounds in onions significantly boost bone health. A 2009 study in the Journal of Menopause found that daily onion consumption improved bone density in women aged 50 and older. This is due to bioactive compounds like quercetin and its derivatives, which have antioxidant properties that reduce inflammation and oxidative stress, helping to prevent bone deterioration. Onions also contain cysteine sulfoxides and other sulfur compounds that benefit connective tissue and bone metabolism. Quercetin, in particular, inhibits osteoclastogenesis, the process of bone tissue breakdown, helping to maintain bone density and strength. Additionally, rutin in onions supports bone regeneration and reduces fracture risk. These findings highlight the role of onions in promoting bone health and maintaining skeletal integrity. Including raw onions in your diet can help maintain strong bones and prevent bone-related conditions, especially for those at risk of bone density loss. Their rich flavonoid and sulfur compound content offers a natural way to support and enhance bone health. 4. Improving sleep. Onions are rich in nutrients and natural antioxidants, including tryptophan, an amino acid that supports the body's production of the hormone melatonin. Melatonin plays a crucial role in reducing sleep difficulties and helps the brain achieve deep sleep. Consuming onions before bed can contribute to better sleep quality, reduce insomnia, and lower stress levels. Additionally, the dietary fiber and vitamin C in onions help reduce stress levels in the evening, further aiding improved sleep. 5. Allergy relief. Raw onions can help alleviate allergy symptoms thanks to compounds like quercetin and quercetin glucosides. A 2016 study in Molecules showed that quercetin prevents the release of histamine, reducing allergic reactions by stabilizing mast cells. Onions also contain cysteine sulfoxides, which have anti-inflammatory effects that may aid in allergy relief by clearing respiratory pathways. Additionally, flavonoids like rutin enhance the anti-inflammatory and antioxidant benefits of quercetin, making it more effective against allergies. Eating raw onions can provide a natural remedy for managing allergies, utilizing their antihistamine, anti-inflammatory, and antioxidant properties for optimal relief. 6. Digestive system protection. A diet rich in onions benefits the digestive system due to their fiber content and bioactive compounds. The fiber in onions acts as a prebiotic, promoting the growth of beneficial gut bacteria and ensuring smooth digestion. A 2021 study in Frontiers in Nutrition highlighted onion a sulfur compound in onions that protects against gastrointestinal infections and supports gut lining integrity, enhancing digestive health. Onions also contain quercetin and its derivatives, such as quercetin 3-glucoside and quercetin 4-glucoside. These flavonoids have anti-inflammatory properties that reduce gut inflammation and help manage conditions like irritable bowel syndrome, IBS. Quercetin also modulates gut microbiota, contributing to a balanced digestive ecosystem. Incorporating onions into your diet can naturally support and enhance digestive health, making them a valuable addition to a gut health-focused diet. 7. Respiratory system protection. Raw onions are packed with compounds that support respiratory health, particularly quercetin and cysteine sulfoxides. Quercetin, a potent antioxidant, has strong anti-inflammatory properties that can help alleviate asthma and bronchitis by reducing histamine production and allergic responses. Cysteine sulfoxides, responsible for onions' pungent smell, have mucolytic properties that help break down mucus and clear airways, which is beneficial for congestive respiratory conditions. A 2023 study in the Journal of Nutrients noted the effectiveness of these compounds in preventing inflammation and respiratory infections. Onions also contain flavonoids like quercetin-3-glucoside and quercetin-4-glucoside, which boost antioxidant defenses against respiratory pathogens. This multi-layer defense helps manage symptoms and supports the immune system in fighting respiratory infections. Including raw onions in your diet can naturally improve respiratory health by enhancing lung function and protecting against infections, making them a valuable addition to a respiratory health-focused diet. 8. Hepatorenal protection. Raw onions support liver and kidney health due to their rich bioactive compounds, including onion A, quercetin, and cysteine sulfoxides. A 2018 study in the Indian Journal of Clinical Biochemistry showed that onion A reduces inflammation and oxidative stress in the liver, mitigating liver damage by lowering pro-inflammatory cytokines and boosting antioxidant enzymes. Quercetin and its derivatives, like quercetin-3-glucoside and quercetin-4-glucoside, are vital for kidney health as they prevent fibrosis and improve renal function by modulating tissue fibrosis pathways and neutralizing harmful free radicals in liver and kidney tissues. Cysteine sulfoxides in onions produce thiosulfonates and other sulfur compounds with antioxidant and anti-inflammatory properties, aiding in liver detoxification. Regular consumption of raw onions can naturally support liver and kidney function, protecting and enhancing their health. 9. Neuroprotection. Raw onions are rich in compounds that protect the brain, making them important in nutritional neuroscience. Quercetin and its derivatives, such as quercetin-3-glucoside and quercetin-4-glucoside, are key for neuroprotection due to their anti-inflammatory and antioxidant properties. These help combat oxidative stress and inflammation, which contribute to diseases like Alzheimer's and Parkinson's. A 2021 study in the Journal of Clinical Biochemistry and Nutrition found that quercetin from onions can reduce age-related cognitive decline by protecting neurons and enhancing brain function. Onion A, another sulfur compound, helps prevent neurodegenerative disorders by protecting against neuroinflammation and neuronal damage. Cysteine sulfoxides in onions aid in forming glutathione, an antioxidant crucial for defending against brain cell damage. These compounds collectively support brain health and offer a preventive strategy against cognitive deterioration. Including raw onions in your diet can significantly impact neurological health, supporting brain function and protecting against cognitive decline. This emphasizes the importance of dietary choices in maintaining and enhancing brain health. 10. Antimicrobial activity. Recent studies show that raw onions have strong antimicrobial properties. A 2022 study in Food Frontiers highlighted compounds like onion A and cysteine sulfoxides that inhibit the growth of various bacteria, including antibiotic-resistant strains. Onion A, a sulfur compound, disrupts bacterial cell walls, hindering their growth and survival. Quercetin and its derivatives, such as quercetin-3-glucoside and quercetin-4-glucoside, also contribute significantly to the antimicrobial effects of raw onions. These flavonoids interfere with microbial membranes and inhibit bacterial enzymes crucial for infection and survival. The combined effects of these compounds make raw onions a powerful natural remedy for reducing microbial presence and enhancing food safety. Including raw onions in your diet can help manage and prevent microbial infections, leveraging their antimicrobial properties for better health. 11. Anti-obesity activity. Raw onions have compounds like quercetin and quercetin glucosides that help fight obesity. A 2020 study in the Journal of Inflammation Research showed quercetin improves lipid metabolism and reduces inflammation, Key factors in obesity management. Quercetin glucosides also help regulate blood sugar and improve metabolic health. These flavonoids influence fat accumulation and energy use, not just calorie intake. Adding raw onions to your diet can boost metabolic health and aid in weight management. Combined with a balanced diet and healthy lifestyle, raw onions are a useful tool against obesity, offering more than just flavor. 12. Supporting heart health. Raw onions are rich in compounds that promote heart health. One of the key components is quercetin, an antioxidant flavonoid known to lower high blood pressure, a significant risk factor for heart disease. A 2010 study in the Journal of Agricultural and Food Chemistry found that quercetin effectively reduces blood pressure in adults with hypertension. Onions also contain sulfur compounds like thiosulfonates and saponin, which have anti-inflammatory properties that help reduce chronic inflammation, a factor in heart disease. Additionally, organosulfur compounds in onions are linked to better heart health by lowering cholesterol levels and improving overall vascular function. A 2020 study in Frontiers in Nutrition showed that these organosulfur compounds help reduce blood vessel stiffness, enhancing arterial health and preventing heart disease. In summary, the compounds found in raw onions offer a natural and effective way to support heart health. Including raw onions in your diet can provide significant cardiovascular benefits, making them an excellent choice for a heart-healthy diet. 13. Anti-inflammatory properties. Raw onions are great for reducing inflammation due to several important compounds. Quercetin, a flavonoid found in large amounts in onions, is particularly good at decreasing inflammation. It works by blocking enzymes that cause inflammation and stopping agents like leukotrienes and prostaglandins. A 2022 study in the journal Molecules showed quercetin's effectiveness in managing inflammation, suggesting it can help with various inflammatory diseases. Onions also contain thiosulfonates, which are sulfur compounds with anti-inflammatory properties. These compounds reduce the production of cytokines, which play a major role in inflammation. The sulfur compounds in onions also help detoxify the body, which can reduce inflammation caused by toxins. Eating raw onions regularly can help manage chronic inflammation and prevent conditions like cardiovascular diseases and arthritis. The combination of antioxidants and sulfur compounds in raw onions makes them a great choice for reducing inflammation and supporting overall health. 14. Improving the skin. Onions are rich in vitamins E and A, which help protect the skin from fine lines and reduce the appearance of aging signs. The antioxidants in onions prevent wrinkles and promote a youthful appearance. Additionally, the vitamin C in onions enhances skin health, giving it freshness and radiance while helping to eliminate dark spots and pigmentation. Onions also have strong antibacterial properties, making them effective in treating acne and bacteria. Their high acidity can also contribute to the removal of moles on the skin. 15. Improving hair. Onion juice has many effective properties and vital compounds that strengthen hair follicles and treat scalp issues. Rich in sulfur, onions help stimulate blood circulation in the scalp and increase the oxygen supply to hair follicles, which strengthens hair roots and promotes hair growth. Sulfur also increases hair density and treats fungal or bacterial infections in the scalp that can cause hair damage and loss. Additionally, onion juice is highly effective in fighting and eliminating dandruff. 16. Enhancing testosterone. Onions are highly beneficial for men as they boost testosterone production and improve blood circulation throughout the body. This increased blood flow results in enhanced energy and vitality. The flavonoids in onions help combat diseases that reduce blood flow and also improve sperm quality. Onions are rich in vitamin B1, which provides energy to sperm cells, and vitamin B2, which fights free radicals that can harm sperm health. Additionally, onions can reduce the risk of prostate enlargement. 17. Anti-diabetic activity. Raw onions are excellent for controlling blood sugar, particularly for people with diabetes. A 2013 review in Preventive Nutrition and Food Science highlights the anti-diabetic properties of onions due to their active compounds. Quercetin, a powerful antioxidant in onions, helps the body respond better to insulin and manage blood sugar levels. Other compounds like alliinase, sulfoxides, and methionine form beneficial substances when onions are cut or chewed, aiding in lowering blood sugar by boosting insulin release and improving glucose management. Flavonoids like rutin also support blood sugar control by improving blood lipid profiles and enhancing antioxidant defenses. In summary, raw onions can naturally help manage diabetes by enhancing insulin response, regulating blood sugar, and supporting overall metabolic health. Choosing the right type of onion is important for maximizing health benefits, as different onions contain varying levels of beneficial compounds. Red onions are generally considered the healthiest option due to their high antioxidant content, particularly quercetin and anthocyanins, which give them their vibrant color. Yellow onions are also a great choice, offering a high level of flavonoids and sulfur compounds that provide various health benefits. White onions, while slightly lower in these compounds, are still a healthy option and may be easier to digest for some people. In terms of consumption, it's generally recommended to eat about half to 1 raw onion per day to gain health benefits without causing digestive discomfort. It's more effective to include onions regularly in your diet rather than consuming large amounts occasionally. However, it's important to avoid overconsumption, as eating too many raw onions can cause gastrointestinal distress, such as bloating, gas, and heartburn. Additionally, onions should be stored properly in a cool, dry place to preserve their nutritional quality, as improper storage can lead to spoilage and a reduction in health-promoting compounds. Finally, while onions are highly nutritious, they should be part of a varied diet that includes a wide range of fruits and vegetables to ensure a balanced intake of nutrients. And that brings us to the end of today's exploration of the incredible health benefits of onions. We hope you found this information as fascinating as we do. If you enjoyed the video and learned something new, please give us a thumbs up. It really helps our channel grow and reach more health enthusiasts like you. We'd love to hear your thoughts and experiences in the comments section below. Have you tried using onions for their health benefits? What's your favorite way to incorporate them into your meals? Make sure to hit that subscribe button and turn on the notification bell so you never miss out on our latest videos packed with tips and tricks for a healthier lifestyle. Together, we can embark on this journey toward better health and well-being. Thank you for watching, and we look forward to seeing you in our next video. Hello everyone. Welcome back to Healthy Care. Today, we're diving into an important topic: the products that can harm our liver. This vital organ plays a crucial role in our overall health, and at the end of this video, I'll share the top 4 products that can help restore its functionality. The liver is one of the largest and most essential organs in our body, located on the right side of the abdominal cavity, just beneath the diaphragm. It performs countless functions, including filtering toxins from our blood and maintaining a balanced composition of bodily fluids. Every component of the food we consume is absorbed through the gastrointestinal tract and sent to the liver, where it undergoes vital transformations. In addition to detoxification, the liver synthesizes bile and is involved in various metabolic processes, helping to clear our bodies of waste. To keep this organ healthy and prevent liver diseases, it's essential to focus on proper and balanced nutrition. So, let's jump right into the harmful products that can negatively impact liver health. 1. Canned foods. Canned foods are often high in sodium, which is used as a preservative. Excessive sodium intake can contribute to liver fibrosis, an early sign of liver scarring. Additionally, many canned foods are loaded with added sugars and unhealthy fats that can exacerbate liver issues. When choosing canned products, it is important to opt for low sodium or no added salt options to minimize potential risks to liver health. Furthermore, being mindful of the sugar and fat content in canned goods can help protect overall liver function, making it advisable to prioritize fresh or minimally processed foods whenever possible. Incorporating more whole foods into your diet can lead to significant improvements in liver health. 2. Alcohol consumption. Excessive alcohol consumption is one of the most significant threats to liver health. The liver is tasked with metabolizing alcohol, and when it is overwhelmed by excessive amounts, it can lead to impaired detoxification, liver inflammation, and a host of liver diseases, including alcoholic hepatitis and cirrhosis. Chronic alcohol abuse prevents the liver from regenerating effectively, leading to long-term damage and a diminished ability to detoxify harmful substances. Moreover, mixing alcohol with carbonated drinks can exacerbate the strain on the liver, leading to more severe health complications. Practicing moderation in alcohol consumption is essential for maintaining liver health and preventing irreversible damage. 3. Sweets. Sweets such as candies, cakes, and ice cream are high in refined sugars and unhealthy fats, which can negatively impact liver function. These sugars can cause rapid spikes in blood glucose levels, leading to insulin resistance and increased fat accumulation in the liver. Moreover, the high-calorie content in sweets can lead to overeating and weight gain, placing additional stress on the liver. Excessive sugar intake is directly linked to the development of fatty liver disease, where fat builds up in liver cells, leading to inflammation and damage over time. For those with a sweet tooth, opting for natural sweets made from whole fruits or those low in sugar and devoid of artificial additives can mitigate these risks while still satisfying cravings. Don't forget to hit the subscribe button and join Healthy Care for more tips on living a healthier, happier life. 4. Canned fruits. Although fruits are generally considered healthy, overconsumption, particularly in canned form, can lead to excessive fructose intake. Many canned fruits are laden with added sugars or corn syrup, which dramatically increases their fructose content. High fructose intake is associated with liver fat production, leading to conditions such as non-alcoholic fatty liver disease, NAFLD. Additionally, the preservatives commonly found in canned fruits may contribute to inflammation or allergic reactions in sensitive individuals. For optimal liver health, it is advisable to choose fresh fruits, which provide essential nutrients without the added sugars and preservatives that can burden the liver. 5. Fatty foods. Regular consumption of fatty foods, particularly those rich in saturated and trans fats, can severely affect liver function. Such diets can cause inflammation in liver tissues, significantly increasing the risk of developing chronic liver diseases, including cirrhosis and liver cancer. High-fat diets may lead to steatosis, characterized by fat accumulation in liver cells, which can progress to more severe liver damage. Elevated cholesterol levels from fatty foods can also contribute to cardiovascular issues that further complicate liver health. To promote liver health, it is vital to limit high-fat foods and focus on healthier fats found in sources like fatty fish, salmon, mackerel, nuts, avocados, and olive oil. These healthier fats contain omega-3 fatty acids, which have anti-inflammatory properties and can support overall liver function. 6. Sweet carbonated drinks. Sweet carbonated beverages are high in refined sugars, primarily high fructose corn syrup, which can have serious implications for liver health. The liver metabolizes fructose differently than glucose, leading to an increase in fat production. Regular consumption of sugary drinks has been linked to the development of non-alcoholic fatty liver disease, NAFLD, and obesity. Furthermore, diet sodas, despite being low in calories, contain artificial sweeteners such as aspartame and sucralose, which have been associated with metabolic disturbances and potential liver toxicity. Chronic sugar consumption from these drinks can overwhelm the liver, leading to detrimental health outcomes over time. 7. Red meat. The consumption of red meat, particularly when it is excessive, has been linked to negative impacts on liver function due to its high saturated fat content. Saturated fats can inhibit the liver's ability to metabolize fats efficiently, leading to fat buildup in liver cells. Additionally, red meat is a significant source of heme iron, which, in high amounts, can cause oxidative stress in liver tissues. This oxidative stress can damage liver cells and contribute to the progression of liver disease. While protein is an essential macronutrient, it's important to balance intake by incorporating lean protein sources such as chicken, turkey, or fish. These alternatives provide necessary nutrients without the high saturated fat content that can burden liver health. A diet lower in red meat and higher in plant-based proteins can promote better liver function and overall health. 8. Spicy foods. While spices can enhance the flavor of dishes and offer various health benefits, consuming excessively spicy foods may have negative effects on liver health. Spicy seasonings can irritate the liver, causing it to produce more bile to digest these intense flavors. Excessive bile production can lead to bile duct congestion, increasing the risk of gallstone formation. Furthermore, chronic irritation from spicy foods may exacerbate existing liver conditions, leading to the development of fatty liver disease or promoting inflammation. Individuals with pre-existing liver conditions should be cautious, as excessive spice intake can lead to digestive discomfort and heightened sensitivity. In moderation, spices can be beneficial, but balance is essential. 9. Fried foods. Fried foods, including popular items like French fries and burgers, are particularly harmful to liver health. These foods are typically high in unhealthy fats, especially trans fats, which can lead to inflammation and fat accumulation in the liver. The frying process often produces harmful compounds, such as acrylamide, which may further stress the liver. Moreover, many fried foods are breaded or contain dairy products, which can complicate digestion and increase the liver's workload. Chronic consumption of fried foods has been linked to the development of non-alcoholic fatty liver disease, NAFLD, a condition characterized by excessive fat buildup in the liver that can progress to liver inflammation and cirrhosis if left unchecked. Reducing the intake of fried foods and opting for healthier cooking methods, such as baking or steaming, can significantly benefit liver health. 10. Salty products. Salt and salty products are widely consumed but can have serious repercussions for liver health due to their high sodium content. For example, about 100 grams of salt contains around 3,000 milligrams of sodium, whereas the recommended daily intake for adults is about 2,000 milligrams. Excess sodium in the body can lead to kidney function impairment, affecting how well the kidneys filter waste and maintain fluid balance. This imbalance can place additional stress on the liver, leading to increased blood pressure, which is a significant risk factor for liver damage. Chronic high sodium levels may cause liver fibrosis, where the liver begins to scar, impairing its ability to function effectively. Additionally, elevated sodium can contribute to fluid retention, resulting in swelling and increased pressure in the abdominal cavity, further complicating liver health. Having explored the various products that can harm our liver, it's crucial to focus on what we can do to support this vital organ. By incorporating certain foods into our diet, we can enhance liver function and promote overall health. Let's take a look at some of the most beneficial foods for the liver. 1. Beetroot. Beetroot is a vibrant and nutrient-dense vegetable that offers remarkable benefits for liver health. It contains potent antioxidants, particularly betalains, which help reduce oxidative stress and inflammation within the liver. Beetroot is known to promote the production of liver enzymes that are crucial for detoxification processes, aiding in the breakdown and elimination of harmful substances from the body. Additionally, the high fiber content in beetroot supports healthy digestion and can help lower cholesterol levels, further contributing to liver health. Studies have shown that beetroot juice may enhance liver function and protect against fatty liver disease. You can incorporate beetroot into your diet by adding it to salads, smoothies, or juices, or even roasting it as a delicious side dish. 2. Green leafy vegetables. Leafy greens such as spinach, kale, arugula, and Swiss chard are powerhouse foods packed with essential nutrients that significantly benefit liver health. These vegetables are rich in chlorophyll, a pigment that helps detoxify the liver by binding to toxins and harmful substances in the bloodstream, facilitating their removal from the body. Green leafy vegetables provide a wealth of vitamins, including vitamins A, C, and K, which are essential for maintaining liver health and function. Their high antioxidant content helps combat oxidative stress and inflammation, which are common contributors to liver disease. Regularly including a variety of leafy greens in your meals can enhance liver function, support overall detoxification, and improve nutrient absorption. You can enjoy them in salads, smoothies, stir-fries, or as a cooked side dish. 3. Walnuts. Walnuts are not only a delicious snack but also a powerhouse of nutrients that support liver health. They are an excellent source of omega-3 fatty acids, which are known for their anti-inflammatory properties. In addition to omega-3s, walnuts contain high levels of glutathione, a powerful antioxidant that plays a key role in detoxifying the liver and protecting it from damage. Research suggests that regular consumption of walnuts can help reduce liver fat and improve overall liver function. Furthermore, walnuts are rich in vitamin E, which can also provide protective benefits against liver disease. Adding a handful of walnuts to your diet can be easy, whether as a snack, a topping for oatmeal or yogurt, or incorporated into salads and baked goods. 4. Turmeric. Turmeric, often referred to as a superfood, is a spice renowned for its active compound, curcumin, which boasts powerful anti-inflammatory and antioxidant properties. Curcumin has been extensively studied for its potential to enhance liver detoxification and protect liver cells from damage caused by toxins and free radicals. Research has shown that turmeric can help reduce the risk of liver diseases, including non-alcoholic fatty liver disease, NAFLD, and liver fibrosis, by improving bile flow and promoting healthy liver function. Additionally, turmeric may support the regeneration of liver cells and help reduce inflammation within the liver. To reap the benefits of turmeric, you can add it to curries, soups, smoothies, or even golden milk, a soothing drink made with turmeric and milk. 5. Garlic. Garlic is a powerhouse when it comes to supporting liver health. It helps activate liver enzymes that are crucial for removing toxins from the body. The key compounds in garlic, particularly allicin and sulfur compounds, not only aid in liver cleansing but also enhance its overall function. Additionally, garlic has been shown to have anti-inflammatory and antioxidant properties, which can further protect the liver from damage. However, it's important to consume garlic in moderation. Excessive amounts may lead to digestive issues such as bloating or gas and can exacerbate liver function in sensitive individuals. Incorporating garlic into your meals can provide significant health benefits without overwhelming the liver. 6. Coffee. Numerous studies suggest that coffee consumption can significantly reduce the risk of liver diseases, including cirrhosis and liver cancer. Drinking about 2 cups of coffee a day has been linked to a lower risk of liver scarring, thanks to its ability to reduce liver fat and enhance antioxidant levels. Coffee contains compounds such as chlorogenic acid, which may help protect liver cells and improve their function. Additionally, coffee consumption has been associated with improved metabolic markers, which can be beneficial for individuals at risk of liver disease. However, it's essential to monitor caffeine intake and choose lower-calorie options, as adding excessive sugars or cream can negate some of the health benefits. 7. Pumpkin. Pumpkin is not only a delicious addition to various dishes but also a fantastic ally for liver health. It is rich in vitamin T, also known as vitamin T1, which plays a vital role in digesting fatty foods and supporting liver cell metabolism. Pumpkin is also packed with antioxidants, vitamins A and C, and fiber, all of which contribute to protecting liver cells and assisting in the breakdown of fats. The beta-carotene present in pumpkin helps reduce oxidative stress in the liver, which can prevent liver damage and promote overall liver function. Adding pumpkin to your diet, especially in meals rich in fats, can help maintain a healthy liver. 8. Avocado. Avocado is a nutrient-dense fruit that provides numerous benefits for liver health. It is rich in antioxidants, particularly glutathione, which is essential for filtering harmful substances from the liver and protecting it from damage. The anti-inflammatory properties of avocados, along with vitamins C and E, help reduce inflammation in liver tissues and combat oxidative stress. Moreover, avocados contain healthy monounsaturated fats that support the absorption of fat-soluble vitamins and contribute to overall liver health. Regular consumption of avocado may help improve liver function and reduce the risk of liver diseases, making it a valuable addition to a balanced diet. And that brings us to the end of today's video. As we've seen, the liver is an incredibly important organ that works hard to keep our bodies healthy by filtering out toxins and supporting various metabolic functions. By avoiding harmful products like processed foods, excess sugar, and alcohol, and incorporating beneficial foods like garlic, pumpkin, walnuts, and avocado, we can significantly improve liver health and maintain its optimal function. Remember, taking care of your liver through proper nutrition and lifestyle choices can have a profound impact on your overall well-being. If you found this information helpful, please give this video a thumbs up and share it with your friends and family to spread the knowledge. And don't forget to subscribe to Healthy Care for more valuable tips on maintaining a healthy lifestyle. Thanks for watching, and see you in the next video. Welcome back to our channel. Did you know that some common medications can increase the risk of liver damage? Have you ever wondered if the daily pill you take might be harming your liver health? Today's video will reveal surprising information about 10 common medications that can cause liver damage, according to recent studies. Let's explore what these medications are, understand the associated risks, and discover safer alternatives for treating conditions like pain, cholesterol, depression, and infections. This video will provide you with crucial insights that could change the way you approach medical treatment and protect your liver health. Stay tuned until the end because the 10th medication is the most dangerous, and many people take it without realizing the risks. You will be surprised by what you learn. 1. Methotrexate. Methotrexate is widely used to treat conditions such as rheumatoid arthritis and psoriasis, but it can cause liver toxicity, especially with long-term use. Methotrexate can lead to increased liver enzymes, such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, which are markers of liver damage. This can occur even at low doses commonly used in treating rheumatic diseases. Regular monitoring of liver enzyme levels is crucial for early detection of liver injury. Long-term use of methotrexate can increase the risk of liver fibrosis, a condition characterized by excessive fibrous tissue in the liver, potentially leading to cirrhosis. Regular liver function tests are essential to manage this risk effectively. This preventive measure helps mitigate some adverse effects associated with methotrexate therapy. For patients experiencing elevated liver enzymes or other signs of liver damage, reducing the dose of methotrexate or switching to alternative therapies may be necessary. 2. Acetaminophen, paracetamol. Acetaminophen, also known as paracetamol, is commonly used for pain relief and fever reduction. Although generally safe at recommended doses, excessive use or overdose can lead to severe liver damage, making it a leading cause of acute liver failure. Acetaminophen can be toxic to the liver, particularly when taken in high doses or combined with other products containing acetaminophen. This is because the liver metabolizes the drug, and high doses can deplete glutathione, a substance necessary to protect liver cells from damage. Overdose of acetaminophen is a major cause of acute liver failure, a life-threatening condition. Do not exceed the recommended dosage, typically not more than 4 grams, for 1,000 milligrams, per day for adults. Avoid simultaneous use with other acetaminophen-containing products. Many medications, including cold and fever remedies, also contain acetaminophen, so it's essential to check labels before use. If symptoms such as nausea, vomiting, abdominal pain, or jaundice occur, discontinue the medication and consult a healthcare provider immediately. The use of acetaminophen should be closely monitored, especially in individuals with liver issues or those who consume alcohol regularly. Don't forget to subscribe to our channel to get more helpful health information. 3. Allopurinol. Allopurinol, used to treat gout, can cause liver dysfunction. Regular liver function monitoring is crucial for those on long-term allopurinol therapy. Allopurinol can cause serious liver-related side effects, including elevated liver enzymes, hepatitis, and in rare cases, liver failure. This usually occurs due to the metabolism of the drug in the liver, leading to the accumulation of harmful metabolites. Some patients may experience allergic reactions to allopurinol, resulting in liver issues such as Stevens-Johnson syndrome and toxic epidermal necrolysis, both of which can cause severe liver damage. Symptoms include jaundice, fatigue, nausea, and abdominal pain. Studies have linked allopurinol to elevated levels of liver enzymes like ALT and AST, which indicate liver cell damage. Regular monitoring of these markers is necessary to detect any abnormalities early. To mitigate the risk of liver damage, patients should undergo regular liver function tests throughout their allopurinol treatment. Adjusting the dosage or discontinuing the medication may be necessary if signs of liver damage appear. Consult with your healthcare provider to ensure safe and effective treatment management. 4. Nitrofurantoin. Nitrofurantoin is an antibiotic commonly used to treat urinary tract infections. While effective in treating these infections, nitrofurantoin can also cause serious liver damage, particularly with long-term use or at high doses. Nitrofurantoin can cause liver-related issues ranging from mild hepatitis to severe liver damage, including cirrhosis. The hepatotoxic effects may be due to immune-mediated responses or the accumulation of toxic metabolites in the liver. Symptoms of liver damage from nitrofurantoin can include fatigue, nausea, abdominal pain, jaundice, yellowing of the skin and eyes, and elevated liver enzymes, AST. Jaundice is a distinctive sign of liver dysfunction, often related to the accumulation of bilirubin in the blood. These symptoms may appear after several weeks or months of medication use and can become more severe if not promptly addressed. In some cases, nitrofurantoin-induced liver damage is a result of an abnormal immune response, leading to autoimmune hepatitis. This condition involves the immune system attacking liver cells, causing inflammation and damage. It is a serious condition requiring immediate medical intervention to prevent long-term liver damage. 5. Amiodarone. Amiodarone is widely used to treat arrhythmias but has significant potential for liver toxicity, including leading to conditions such as cirrhosis. This medication can cause both reversible and irreversible liver damage, which is often exacerbated by prolonged use. Amiodarone has been linked to liver injury through its accumulation in the liver, which can lead to steatohepatitis and cirrhosis. This occurs because the drug inhibits mitochondrial beta oxidation of fatty acids, causing fat accumulation in liver cells, which can progress to cirrhosis. The risk of developing cirrhosis increases with higher doses and prolonged use of the medication. The liver toxicity associated with amiodarone is believed to be due to the formation of Mallory-Denk bodies and hepatocytes, which indicate cellular damage. Amiodarone can also lead to phospholipidosis, where phospholipids accumulate in the liver cells, further contributing to liver damage. Patients using amiodarone may experience symptoms of liver dysfunction, including jaundice, fatigue, nausea, and elevated liver enzymes. In severe cases, this can progress to acute liver failure, particularly in patients with pre-existing liver conditions or other risk factors such as alcohol use or metabolic syndrome. 6. Tamoxifen. Tamoxifen is widely used for the treatment and prevention of breast cancer. While effective in reducing the risk of cancer recurrence, tamoxifen can have significant effects on liver health, potentially leading to serious complications. Tamoxifen can induce hepatic steatosis, commonly known as fatty liver disease. This condition involves the accumulation of fat in liver cells, which can potentially progress to non-alcoholic steatohepatitis, NASH, fibrosis, or even cirrhosis if not managed appropriately. The risk of developing fatty liver is particularly higher in patients with obesity, diabetes, or other metabolic conditions. Elevated liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, have been observed in patients undergoing tamoxifen therapy. These enzymes are markers of liver inflammation or damage, and their elevation indicates that the liver is under stress, potentially from the drug's hepatotoxic effects. In more severe cases, tamoxifen can lead to non-alcoholic steatohepatitis, NASH, a more aggressive form of fatty liver disease characterized by liver inflammation and cell damage. NASH can progress to fibrosis, cirrhosis, and increase the risk of liver cancer. 7. Valproic acid. Valproic acid, also known as valproate, is widely used for treating epilepsy and bipolar disorder. However, this medication carries significant risks for liver health, particularly in certain populations. Valproic acid is known to cause liver toxicity, with the risk being higher in children under the age of 2, patients with mitochondrial disorders, and those with a history of liver disease. The mechanism involves the disruption of mitochondrial function, leading to an accumulation of toxic metabolites that can damage liver cells. This can result in conditions ranging from mild elevations in liver enzymes to severe liver failure. Symptoms of valproic acid-induced liver toxicity can include jaundice, yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and unexplained bruising or bleeding. These symptoms can indicate serious liver damage, including fulminant hepatitis, which is a rapid and severe form of liver inflammation. These include infants and young children, particularly those with genetic metabolic disorders such as urea cycle disorders or mitochondrial diseases. Patients with these conditions may experience an exacerbated toxic effect due to an inability to adequately metabolize the drug. 8. Oral contraceptives. Oral contraceptives, particularly those containing high levels of estrogen, are widely used for birth control and other medical purposes. However, they can pose certain risks to liver health, which vary based on the formulation and dosage of the hormones used. Some oral contraceptives can lead to elevated levels of liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase. These enzymes are markers of liver inflammation or damage. Elevated levels may indicate that the liver is under stress or has sustained damage, potentially leading to more serious conditions if not monitored and managed appropriately. In rare cases, oral contraceptives, especially those with higher estrogen content, have been associated with the development of hepatic adenomas. Although these tumors are generally non-cancerous, they can rupture or bleed, leading to serious health complications. Long-term use of oral contraceptives has been linked, though rarely, to an increased risk of hepatocellular carcinoma, liver cancer. Oral contraceptives can also cause cholestasis, a condition where the flow of bile from the liver is reduced or blocked, leading to symptoms such as jaundice, itching, and liver dysfunction. 9. Antidepressants. Certain antidepressants, particularly tricyclic antidepressants, TCAs, like amitriptyline, have been associated with hepatotoxic effects, which can lead to liver inflammation, cause liver enzyme elevations or damage. This hepatotoxicity may manifest as a range of liver conditions, from asymptomatic enzyme elevations to more severe liver inflammation, hepatitis, or even jaundice. The exact mechanism is not fully understood but is thought to involve direct hepatocyte toxicity or immune-mediated responses. Patients may experience symptoms such as fatigue, nausea, abdominal pain, and jaundice if they develop significant liver injury from TCAs. Monitoring liver function tests, LFTs, before and during treatment is crucial, especially in patients with pre-existing liver conditions or those taking other hepatotoxic medications. This monitoring helps detect early signs of liver dysfunction, allowing for timely intervention. The risk of liver damage may be higher in individuals with certain risk factors, including those with existing liver disease, alcohol use, obesity, or metabolic conditions such as diabetes. The elderly and those on long-term TCA therapy may also be at greater risk due to prolonged exposure and age-related decreases in liver function. 10. Herbal supplements. Herbal supplements, such as kava, comfrey, and certain Chinese herbs, are popular for their perceived natural benefits. However, these supplements can pose significant risks to liver health, particularly because they are not subject to the same rigorous testing as prescription medications. Kava is a popular herbal supplement used for its calming effects. However, it has been linked to severe liver toxicity, including hepatitis, cirrhosis, and liver failure. The hepatotoxicity of kava is thought to be related to cavalactones, its active compounds, which can cause mitochondrial dysfunction and oxidative stress in liver cells. Comfrey contains pyrrolizidine alkaloids, which are highly toxic to the liver. These compounds can lead to veno-occlusive disease, a condition where the small veins in the liver are blocked, leading to liver damage and potentially liver failure. Some traditional Chinese herbal medicines, such as those containing aristolochia or certain compounds from the genus Polygonum, have been associated with liver toxicity. Aristolochic acids, in particular, are nephrotoxic and hepatotoxic, potentially leading to acute liver injury, fibrosis, or even liver cancer. Unlike prescription medications, herbal supplements are not required to undergo rigorous clinical testing for safety and efficacy before being marketed. In this video, we've explored the potential liver-related risks associated with 10 commonly used medications, including both prescription drugs and herbal supplements. From acetaminophen and valproic acid to herbal remedies like kava and comfrey, these substances can cause a range of liver issues, including fatty liver disease, hepatitis, cirrhosis, and even liver cancer. It's crucial to understand that while these medications can be effective in treating various conditions, they must be used cautiously, especially in individuals with pre-existing liver conditions or those taking multiple medications. Regular liver function monitoring and consultation with healthcare providers are essential to ensure safe use and to detect early signs of liver damage. Remember, the liver is vital for detoxifying the body and maintaining overall health. Protecting your liver by being informed about the potential risks of medications is a key step in preventing severe complications, including liver cancer and liver failure. Thank you for watching, and don't forget to like, subscribe, and consult with your healthcare provider before making any changes to your medication regimen. Stay healthy and take care of your liver.